thriver, inspires with his resilience, and is known for his work as an artist, educator, and arts advocate.
Take a seat. Thank you.
I love it.
Up next, we have Dr. Monique Gary. Yes, Dr. Gary is a breast oncology surgeon and founder of Still Rise Farms. She believes in the power of the connection between mind, body, and spirit to promote overall wellness. Next, we have Rebecca Custers, founder of Live Like Lucas Inc., which was formed in late 2017 after an untimely death of Lucas Custers, also known as the Dutch Destroyer. Everyone, thank you. We have next, Danielle Massey, a best-selling author, come on in, girl, compelling keynote speaker and CEO of the Wellness Collective, a groundbreaking virtual holistic healing center serving clients globally. Next, we have Larissa Morgan, a pioneer breast cancer thriver. Larissa Morgan brings a unique perspective to the realm of survivorship. We also have Tolu Oyendi. Did I say that? Yes, Tolu, hi! Sharing her journey with metastatic breast cancer, aiming to uplift and inspire others navigating similar paths. And then we have Melissa Ryder. She is a breast and colon cancer thriver who brings a wealth of personal experience and advocacy to the forefront of the cancer fight.
Yes, thriving. Yes.
I love the support. And last but not least, you just saw her in the touching documentary. We have Erica Jo Robinson. She is a Cancer 4B thriver. Yes. Erica Jo Robinson, thank you. I'm gonna need you guys to clap it up just a little bit more. We have some amazing guests here. Okay? And last but not least, we have someone coming in. And last but not least, we have DrChalice she's a mental health specialist.
Yeah.
Thank you. Wow, I am honored to be sitting here with some amazing thrivers, some amazing survivors, as well as just being the face for us of what it means to be resilient and to continue to live. My first question, for anyone who wants to answer, I'll pass it on the mic as we go on. Thank you. As cancer thrivers, what are some areas of wellness or holistic care that you feel are often overlooked in conventional cancer treatment, but you believe are essential?
I'm just gonna rip the Band-Aid off here.
Yes, please.
I would say two holistic approaches that are usually overlooked is Reiki and acupuncture. So Reiki is a technique that focuses on energy, and a lot of times our chakras are blocked. Our chakras are blocked due to distress, which can cause anxiety, depression. A lot of our traumas are there. So when you go to the Reiki, it's almost like a realignment of your body, and you're left almost feeling like you hit a reset button. For acupuncture, it pinpoints the problem areas. So for people that are in chemotherapy, it can help with the side effects of nausea, insomnia, distress and anxiety of the things that you're going through. And then when we transition out of chemo, it can also help with the long-term medication effects like joint and muscle pains. And what I like about the approach is that I feel like a lot of people think that you have to choose between science or holistic, and in my experience, you can incorporate both.
Come on. Yeah, come
I have to agree. I think anytime I talk to someone about like holistic processes, they're like, what is that? You know, I'm just going to listen to the doctors, take the hard medication. So involving both, absolutely. Does anybody else want to answer? Oh yes, you're pass it on the mic.
Hello everyone, my name is Dr. Chalice Rose. I'm a licensed professional counselor and a cancer oncology behavioral health specialist. And in my practice, I take a holistic perspective. So our mental health, which is our thoughts, our feelings, and our behaviors, also includes our physical health, which is our nutrition, our exercise, and our sleep. We need like 7 to 9 hours of sleep a night for the average adult. But then we can't forget about our spiritual health, right? So whatever your sense of spirituality is for you. For me, I specialize in Christian counseling, and so incorporating that, strengthening my relationship with God, praying, getting the support of my faith-based community is definitely what got me through as a breast cancer survivor.
I see a few children in the room, so you might want to cover their ears, but I'm going to say sexual health. I think is really overlooked. Being a breast cancer survivor, dealing with a lot of body image issues and side effects from medications, and really how to, one, reconnect with my own body before I can let someone else reconnect with my body. Has been, I would say, really challenging, and I think it's not really talked about too much. And I think the other component of wellness, and I'm a nurse, and so I understand environment, and your environment, and how important your environment is to your own mental health. We have a lot of clutter, if it's not clean, if there's a lot of things around you that don't really bring you joy or lift your spirit, even the colors and the sense that you have, and how your environment, especially when you're recovering and taking treatments, it really has an impact on your psyche and your mental health.
Absolutely. You got to keep that in mind. I think this one's working now. We got it to work. So as we're talking about practices and other methods, are there any resources or support networks that you discovered post-diagnosis that you wish you had known maybe earlier on in your journey?
I'm going to take this one because when I was going through cancer, I was looking for that. I'm also a licensed mental health professional, and while I knew what I should do, I couldn't find what I needed, so I made it. So I created the Selfish Philly Conference. If you guys have ever heard of it before. We have between 5,000 and 1,000 women who come and work with us every single year. I bring together all of the best self-care resources. That's holistic doctors, that's faith-based practices, that's tea vendors, it's anything that might help you get better. I put them all in one space with the American Cancer Society so that if there's anything you're looking for, you're going to find it with us. So I hope that we become that resource for all of you.
Absolutely.
Yes, and I also have a resource to share. So like my fellow therapist, I could not find what I needed either. So I used to teach in higher education for 12 years. So I created my own app. It's called DrChalice Teach, and I offer this free Thrive Breast Cancer Survivorship course. So for all of my survivors in here, or even caregivers, if you go and you download the app, you can access this course. It's 14 hours of training, it's trauma-informed, it's evidence-based, and it explores almost every topic we would think of as a survivor or thriver.
I'm loving the shameless plugs. Yes, I hope you guys are taking in all of these programs.
I don't have a plug. It's wonderful women. I didn't have enough time to research what I needed. So what I did is, when my family couldn't fill in for me, I created a round table of support. I went and found them on YouTube. And I created for myself a playlist every morning that uplifted me and kept me where I'm going. And one of those is, those who know me know I love a good David Goggins, if anybody is familiar. He gave it to me raw, the way that I needed to hear it. And there are a few others. So for those who don't have that opportunity, and you are short on time, you can also go and create your round table on YouTube and pull the voices you need to hear right then and there, and then go and support those individuals that you are believing from.
Yeah.
All right, Dr. Leah. She's looking at me and said, "This is a farm. Say something." So I am the founder of Still Rise Farms, which is a 40-acre farm for integrative wellness for those who are facing cancer and also chronic illness. Because what we realize is that
the issues that people are having through their cancer journey, people are also having with ADHD, with diabetes, with hypertension, with HIV, with everything else, and we are all looking for how can food be medicine? How can mind, body, and spirit work together? What does wellness look like and feel like for me? Because I'm a breast cancer surgeon, and for doctors, many times, if it's not in our textbook and we didn't learn about it, it doesn't exist. And it's why there's this disconnect when you go and you talk to your doctor, because if it's anything other than what is the scientific standard of care, they're not able to speak on it intelligently, and then they poo-poo it, and then you leave feeling stupid, like, well, I asked my doctor about, Reiki, and they said, oh, well, that doesn't work, or, that's not really real. But it is, and we needed a place for us to make that happen. So we created that place. And we do have wellness events, and I guess this is a bit of a shameless plug. You all are all certainly welcome to participate, because the community that we have and that we're building is that wellness is for everyone. And we're democratizing that, and we're making it accessible, and making it, free, and making it a place where we can learn and figure it out, because we are still, in fact, rising. And that's the name of the farm, and that's the philosophy. So we teach food as medicine classes, and we teach healing your traumas. I mean, Cassandra had everybody crying and healing, and it was a beautiful thing. And you all have to visit Black Lotus, by the way. But all of this can, and it does work together, and we need to share these spaces and make sure that folks are aware of them, because so much of cancer care is just isolated, and it feels like you're going through the mill and through the motions of it. But I just love this panel. Thank you for having me.
Yes.
You mentioned the farm.
Shout out to Dr. Nia Bailey for sure. The reason I had asked that question was because I myself had just recently was diagnosed with bipolar 2, and so I was going through that journey of finding things, and I could not find anything. And I went on TikTok to find people, and I found some people that I was like, wow, that's relatable, And so if it wasn't for me doing my own research and finding things, I think I'd be just following whatever I was seeing online or listening to, and those certain things don't match. Everybody's different. Everybody's body is different. So I thank you for all of the honest answers. My next question for you is, for those who have limited or unknown family history when it comes to cancer, what alternative methods or resources would you recommend for assessing the risk factors, or how do they get about being informed?
I guess I'll take that one as a medical doctor. But, there are preventable and non-preventable risk factors. The non-preventable risk factors for many cancers, breast cancer, being a woman getting older, right? Every person has mammary glands, right? Our race, where we live, the experiences that we had, our family history. Those are things you can't prevent, but there are risk-reducing factors and things that you can look at that include like the lifestyle changes. And when you move your body even, just 15, 30 minutes a day, you reduce your risk for certain cancers. When you look at food as medicine, when we begin to incorporate some of that stuff that we believe, we can work on the risk factors that we can. Because we can't always ask the family. Some of us have chosen family and we're estranged from our families. Many of us, like my family, we didn't talk about that stuff. And so we're not able to go back. But you can also go to see a genetic counselor, and if you have an unknown family history, and say, listen, I don't know my history. And they can test you for hereditary mutations. But the catch is, the gag is, only 5 to 10% of all cancers are hereditary. So 90% of them aren't related to a gene mutation. So while you could go ask your doctor about that, the reality is that 90% of our cancers aren't related to that. So you focus on the stuff that you can control, the risk factors that we can modify, and just try to get your body ready for whatever life throws at it.
Wow, I just got educated, because I thought all cancers were pretty much like a genetic thing. So that's good to know. Wow, thank you so much for that. Anybody else? Yes.
Say, as someone who was super, relatively healthy when I was diagnosed, I was 26. I was basically getting ready for the Broad Street Run. I was super fit, eating healthy, and everything, and I still was diagnosed. I did the genetic testing, and it came back negative. So basically, the cancer came out of nowhere. And so I would say this: yes, there's all of these things that are important that you should know. Talk to your family, figure out your genetic testing, eat well, but also just know that this can happen to just about anyone, and that it's not your fault, because I think that was something that I had to I had to deal with is that I was diagnosed at 26 with stage 4 breast cancer. And typically they say, you know, check yourself, you should know, you should catch it early, it's so important. And it's a lot of like blame on the person, but really anything could just happen. So just being aware and being kind to yourself, because you know, anything could happen to the body.
Thank you for that. Can any of you share an experience of telling your loved one about a diagnosis? The reason I ask that is I think that very often, even me sharing my own diagnosis with your family, you're kind of like, ooh, what are they gonna think? Are they gonna believe me? Are they gonna think I'm crazy? Or they're gonna start worrying about, okay, well, where does it come from? You know, all these different things. So can anyone be vulnerable enough to share their story possibly? Yes, Al did.
I'll share mine. First person I told was my sister. And I thank God for her first and foremost, because my sister Nara and Nethemiah's mother has always and to this day still in my corner. First person I told was there in the hospital with me. Has always been my rock. I was never one to say why me. I just dealt with it. She has been a health nut most of her life. She is to this day a nutritionist, a chef, and she started me on my positive health journey. Eating right, because as a cancer thriver, you do need to look at your health journey and treating your body well. I've never really been a negative health eater, but you really need to think positively about treating your body right. And people who know anything about the Bird Foundation and my family history, we have typically as Black people really have not traditionally eaten correctly. So Narda, in her infinite wisdom, through prayer and supplication and God leading her, has totally changed her way of thinking and has gotten me to think about my health journey. And she's always been there. So when I told her, she has really guided me. So that was the first person I told, and she's always been there. So it's important to have that.
Yes, and they'll definitely shape your entire view.
As a mother, it was challenging having that discussion with my kids. So at the time of my diagnosis, my older two were just at the beginning stages of teenagers, and my youngest was 5. So we had separate conversations. For the older two, we were open and honest. It was interesting for me because my mother had cancer and she passed away young, so for me to be on the other side now was challenging. But my mom kept us in the dark a lot, and not because of a reason to hurt us, but to protect us. And as Dr. Monique said, that back then, you did not know your parents' business. You didn't know anything about their news, what they were going through, everything was private. So I made sure to be open and honest with them, but I would just suggest when you're talking to kids about diagnosis, be honest, but make sure you talk after you've had your plan. Because if you just throw that on them, the same fears that you had when you received it, they're also going to feel also. So they'll say, oh my God, are you going to die? You know, what's going to happen? So if you have a plan set in place and you can say, okay, this is what's going on, these are the next steps, and I promise to update you, it can give a light at the end of the tunnel. And for my youngest, I just told her in a way that she could understand, and then as she aged, because she was only in kindergarten, as she aged, I started using the real terms like cancer and chemo and treatments. So I would just be honest and just make sure you have a plan before you start the discussion.
I'm glad you talked about children, because that was, you know, same here where it's like children are seen, not heard, you don't tell them, they don't know anything, they don't know the histories. And so I had family members that were not for and supported me telling my children. And I had to just say, I'm their mother, and I know what's gonna happen, because for me, being, diagnosed with breast cancer, I knew there were things, and being a nurse, I knew there were things I could not hide. Couldn't hide losing my hair. I couldn't hide having my porta-calf and my kids want to come up and hit me and things like that. And so, I researched and just saw, put it at their level, have a plan, know what to talk about. And, I had at the time, my youngest was 4, my oldest was 7, and I just said, do you know what cancer is? And she said yes, because kids talk, their friends have experiences, and so you don't want them to start telling themselves the story. You want to be a parent and lead that story for them. So that was really important for me to be able to, tell them at an age specific. And the conversation doesn't stop, because as they get older, I need to evolve the conversation. Okay, you're getting a certain age now, because they're girls, you need to start thinking about early detection and what that looks like, because mommy had this. So it was really important for me to be able to tell my kids. And, honestly, when you tell people, at some point I just kind of got annoyed with telling people, because I felt like I had to console them. They're